Nowadays, in a fast-moving world with the people with multi-factorial risk factors, heart attack has become more common. In a case of acute myocardial infarction, where there is an ECG changes and echo changes with a cardiac troponin elevation, there is no doubt that the patient should undergo an angiogram and opening up of vessel using a stent or thrombolysis. Anything other than acute MI, when the patient is found to have a coronary artery disease, the attenders and the patients are having a decision difficulty in deciding whether they have to go on for stenting or CABG. So today upon this we are going to talk. So now I am going to let you know that for whom stenting is best. Stenting is best for the persons, those who are advanced stage, those who are frail, those who have risk factors for surgery, and those who have a single vessel occlusion or a double vessel occlusion which is not complex enough, for whom the stenting is straightforward. So the cardiologist assesses the coronary complexity and the clinical condition of the patient and advises the same. And when you go on for a coronary artery bypass grafting, it is best for coronary lesions which are very much complex, or if it is involving a left main coronary artery disease, or the heart has LV dysfunction on echo, or the patient is diabetic. In these circumstances, we have found that CABG is much more beneficial than stenting. If the patient is having any associated cardiac problem like valvular heart disease, or is requiring heart surgery for other than coronary artery disease, so in this case also coronary artery bypass grafting is preferred over stenting. So there are two things that helps the patient and the relatives to make the decision. One is the complexity of the coronary lesion, second is the clinical condition of the patient. So based on this, you have to decide whether CABG or stenting is beneficial for that patient. It differs from case to case basis, and for this what we have is an heart team approach. So let's understand what is the heart team approach. So in the heart team approach, there are multiple specialists those who are involved. One is the cardiac surgeon, the cardiologist, the cardiac anesthetist, and the rehabilitation physiotherapist. So we have a very big heart team in our hospital specialist, which is headed by Dr. Tamim Ahmed, who is a senior cardiac surgeon, followed by our cardiologist Dr. Prashant, Dr. Vijay, Dr. Sudhakar, and our cardiac anesthetist Dr. Amit Lal. So we sit together along with the family and the patient, discuss the risk versus benefit of each procedure, whether it is stenting or CABG, and helps the patient and the relatives take an informed decision making for their better future.